Hello everyone and welcome to my channel. I'm Mila, and for the past 15 years I've had the privilege of being a flight attendant. I've served countless coffees, helped passengers settle in, and even acted as a first responder at 35,000 feet. But now I'm thrilled to be here on the ground, sharing all the insider knowledge I've gathered over the years. Today's topic is especially important, and yes, I know the title might make you a little nervous. Passengers over 70 must know this before flying. Nobody warns you. You might be thinking this sounds alarming, like I'm going to scare you out of seeing your grandchildren or taking that dream cruise. Maybe you're imagining new rules or thinking, am I too old to fly? Let me be clear, absolutely not. I'm not here to frighten anyone. My goal is to prepare you, to give you the tools so that you can fly safely and comfortably well into your 70s, 80s, and beyond. After years of working at altitude, I've seen firsthand what no one tells older travelers. The airplane cabin is a harsh environment, and it affects a 75-year-old body very differently than a 25-year-old one. What I call the high altitude trap is a combination of three factors: extreme dehydration, low oxygen, and immobility. Each on its own is a stressor, but together, during a 6-hour flight, they create a unique and serious risk. I've seen perfectly healthy passengers board looking fine, only to become pale, dizzy, and disoriented mid-flight. Families panic, fearing a stroke, when in reality, it's this trap at work: dehydration and low oxygen mimicking serious medical events. In this video, I'm going to explain exactly what happens to your body in plain, simple English. Then, I'll give you my flight attendant-approved, non-negotiable checklist for countering every part of it. We're talking about your health, your energy, and arriving at your destination ready to enjoy it, not exhausted, dizzy, or stressed. If this is the kind of practical travel advice you've been looking for, do me a favor. Hit that subscribe button and leave a comment below telling me your biggest worry about flying as you get older. I read every comment, and your experiences help me shape future videos. Now, let's get into part 1 of this guide, the high altitude trap itself. The first part of the trap is extreme dehydration. Stepping onto a plane is like entering a desert. Cabin humidity can be less than 10%, drier than the Sahara. For younger travelers, it's a mild inconvenience, chapped lips or dry skin. But for senior travelers, it's a real risk. As we age, our bodies hold less water, and the thirst mechanism weakens. You may be profoundly dehydrated and not even feel thirsty. Every breath in the cabin robs your body of moisture, thickening blood, raising blood pressure, slowing cognitive function, and making you tired or dizzy. I remember a gentleman on a flight to London in his 70s. He called me over, pale and unfocused, dizzy from dehydration. With slow, careful rehydration, he recovered, but it was a stark reminder of how serious this can be. Now that you understand dehydration, let's talk about the second element of the high-altitude trap, the thin air or hypoxia. When you're cruising at 35,000 feet, the cabin is pressurized, yes, but only to about 8,000 feet above sea level. That means your body is effectively sitting on top of a Colorado mountain the entire flight. The air is thinner, oxygen pressure is lower, and every breath you take delivers about 25% less oxygen than at home. For a healthy 25-year-old, the body compensates. You might notice a tiny sense of fatigue, maybe a foggy feeling, but it's manageable. For a traveler in their 70s or 80s, especially with underlying conditions like COPD, asthma, or reduced lung function, this is serious. Your body is working overtime to get enough oxygen to your brain, your heart, and all vital organs. Combine that with dehydration, and you're in a perfect storm: thick, oxygen-starved blood and a heart working harder than usual. No wonder flights can feel exhausting. It's not just sitting in a seat, it's a physiological challenge. And then comes the third part: immobility. You're confined in a tight seat with limited ability to move, perhaps bags at your feet, afraid to inconvenience your neighbors. Hours of sitting still, combined with dehydration and low oxygen, set the stage for deep vein thrombosis, DVT. This is where blood pools in your lower legs, forming a clot that could travel to your lungs, causing a pulmonary embolism, sometimes fatal. I've had passengers call me mid-flight, complaining of a warm, cramped leg. That's a code red for us, a potential DVT. So, what do we do about it? How do we counteract this deadly trio? That's where the Mila counter plan comes in, the non negotiable checklist that every senior traveler should know. Step 1, the doctor's flight plan. Before you book your flight, go to your physician and be specific. Don't just ask if you're fit to fly. Say, I'm 78 years old, flying 6 hours at cabin pressure equivalent to 8,000 feet with less than 10% humidity. Do I need supplemental oxygen or any medication adjustments? Your doctor can clear you for the flight and suggest a portable oxygen concentrator if necessary. Step 2. The one-sheet rule. Airports are overwhelming, even for seasoned travelers. A one-page document with your flight confirmation, hotel details, car rental info, and contact numbers keeps you grounded when your phone dies or anxiety spikes. Keep it in your pocket, an analog, battery-free lifeline. Step 3. The human shield. Don't view a wheelchair as a sign of weakness. Think of it as a VIP pass through airport chaos. A wheelchair gets you past security lines, long customs queues, and across terminals with minimal exertion. It's not about mobility, it's about conserving energy for the flight. Your escort knows the airport and will guide you directly to your gate, ensuring you arrive calm and prepared. Step 4. Pre-flight hydration. Hydration doesn't start in the air. It begins 24 hours before your flight. Then, immediately after passing security, grab a 1-liter bottle and drink it before boarding. Yes, you'll need a restroom stop. That's part of the plan. Hydration helps counteract both immobility and dehydration, priming your body for the flight. Step 5. The coffee and alcohol trap. Both are diuretics, actively removing water from your body. If you choose to have a cup of coffee or a glass of wine, compensate with at least 2 full glasses of water. Think of water as medicine. It's not optional, it's essential. Step 6. Magic socks. Compression socks aren't just for seniors. They're worn by pilots, flight attendants, and frequent flyers alike. These medically engineered socks squeeze your calves, keeping blood moving and preventing clots. Wear them from the moment you leave your home, and you'll significantly reduce your DVT risk. Step 7. The in-seat workout. With your magic socks on, engage your calf muscles. Try the ankle alphabet. Lift your feet and trace the letters in the air with your toes. This flexes your calves, boosting circulation without leaving your seat. Repeat every 30 minutes. Step 8. The aisle lap. Get up when the seatbelt sign is off, even briefly. Walk to the galley, stretch, touch your toes. The crew doesn't mind. What they fear is a passenger who develops pain or swelling. Moving prevents complications and keeps your body oxygenated. Now that you've mastered hydration, movement, and circulation, let's dive into the next layer of senior-friendly flight strategies. Even if your body is prepared, the way you pack, organize, and present yourself at the airport can dramatically affect your comfort and safety. One of the most overlooked areas is medication organization. Here's the truth. The TSA and other security agencies are incredibly efficient, but they're also strict. A small misstep with your medication can create unnecessary delays, embarrassment, or worse, a confrontation. The single biggest mistake I see over and over again is what I call the jumble bag. This is where people toss everything: pills, inhalers, insulin syringes, topical creams, and even liquid medications into a single bag or side pocket of their carry-on. In 2010, this might have passed through security with minimal attention. In 2025 and beyond, the new CT scanners are hypersensitive. They detect irregular densities, powders, liquids, plastics, and foils. Your disorganized medical bag is flagged instantly. I've watched this happen firsthand. A woman in her 60s, perfectly healthy, had her carry-on pulled. The agent pulled out a rainbow-colored pill organizer, a prescription cream, and a half-empty tube of eye drops. He asked her politely but firmly, "What are these?" She tried explaining, embarrassed, about her blood pressure and joint pain. That innocent chaos turned a 30-second scan into a 10-minute ordeal. Here's the professional fix: pack like a flight attendant. Everything needs its place. Pills stay in their labeled prescription bottles. If you use a pill organizer, keep the original bottles as verification. Liquid medications like insulin, liquid cough syrup, and eye drops get their own clear medical bag, separate from your 311 bag. When you reach the conveyor belt, remove your laptop, shoes, and both clear bags. Look the agent in the eye and simply say, "Hi, I have liquid medications to declare." That's it. Nothing else. You've just told them you are organized, professional, and prepared. Now consider pill organizers for international flights. Domestically, TSA doesn't require pills in original bottles, but agents can still question you. Internationally, a mismanaged pill box can be interpreted as a controlled substance attempt. I once witnessed a young traveler heading to Dubai with an unmarked pill organizer. Without documentation, he was detained for hours, even though the pills were legal in the US. The fix? Always bring the original labeled prescription bottles, plus your organizer for convenience. And for added security, carry a typed doctor's note listing your medications, dosages, and the conditions they treat. This letter is your ultimate proof and can prevent delays or detentions. Next, let's talk about checked bags. Never put critical medications in your checked luggage. Checked bags are tossed, stacked, delayed, and sometimes misrouted. I've seen couples in their 70s arrive for a wedding, only to discover their checked bag containing essential heart medication was lost. Panic ensues, emergency calls are made, and precious moments are ruined. The rule is simple. Medications stay with you at all times. Carry enough for the entire trip plus a buffer. Extra doses in case of delays or cancellations. Remember, cargo holds aren't temperature controlled, so insulin, certain liquids, and fragile medications can be damaged. Finally, documentation is non-negotiable. A prescription bottle alone isn't always enough, especially internationally. Agents may not recognize certain drug names or brand names. A doctor's letter on official letterhead listing every prescription, dosage, and your personal medical need is your fail-safe. This turns a potential confrontation into a smooth, professional checkpoint experience. In short, organization, preparation, and documentation are your new flight essentials. With these in place, the high-altitude trap becomes manageable, and your travel experience becomes safer, smoother, and stress-free. Now that you've got hydration, circulation, and medication organization covered, it's time to tackle the environment inside the airplane itself. Even with all your preparations on the ground, the cabin can still challenge your body, especially if you're over 70. High altitude, low humidity, and prolonged immobility are relentless stressors, but with a few smart strategies, you can neutralize them completely. Let's start with pre-flight hydration. This isn't just a suggestion, it's a requirement for seniors. Your body is entering an extreme environment where the cabin humidity can be less than 10%, drier than the Sahara. For a younger traveler, this is inconvenient. For someone in their 70s or 80s, it's a real risk. Thickening blood, sluggish circulation, and headaches are all consequences of dehydration. The fix is simple. Start 24 hours before your flight. Drink plenty of water the day before, and once you clear security, purchase a large bottle, 1 liter or more, and finish it before boarding. Yes, you might have to use the restroom more, but that's intentional. Every sip keeps your blood flowing and prevents dangerous clotting. Next is the booze and coffee trap. Many senior travelers don't realize that alcohol and caffeine are powerful diuretics. That single glass of wine or cup of coffee removes water from your body and intensifies the dehydration you've just worked so hard to prevent. My rule as a flight attendant is clear. For every cup of coffee or glass of alcohol, drink 2 full glasses of water. Think of water as medicine. It's literally protecting your heart and preventing complications mid-flight. Now, let's talk about compression socks, your second heart. These aren't just for older travelers, they're standard for pilots and crew. Sitting immobile for hours allows blood to pool in the lower legs, creating a serious risk for deep vein thrombosis, DVT. A clot forming quietly in your calf can be deadly if it dislodges and travels to your lungs. Compression socks are medically engineered to squeeze the blood upward, keeping circulation active. Wear them from the moment you step into the airport until you reach your destination. They're not optional, they're life insurance. Once your socks are on, it's time for the in-seat workout, what I call the ankle alphabet. Lift your feet slightly and write each letter of the alphabet in the air with your toes. It may feel silly, but it activates your calf muscles, helping pump blood back to your heart. Do this every 30 minutes during the flight. Combine it with standing and walking every hour when the seatbelt sign is off. Even a short stroll to the galley or a few stretches at your row keeps your blood moving and reduces the risk of clot formation. These movement strategies are the critical final piece of the high-altitude trap solution. Hydrate, control diuretics, compress, and move. When done consistently, you neutralize the 3 silent threats: dehydration, hypoxia, and immobility. Finally, let's touch on the mental component. Airports and airplanes are sensory overload machines. Anxiety, stress, and overthinking can worsen physiological effects. That's why I recommend an analog one sheet. Print your flight itinerary, hotel information, emergency contacts, and airline numbers on a single sheet of paper. Keep it in your pocket. Forget relying on your phone alone. Batteries die, apps crash, and panic sets in. Having a simple reference instantly reduces cognitive stress, allowing you to focus on staying hydrated, moving, and following your safety routine. By combining these four elements, hydration, diuretic management, compression and movement, and mental preparation, you are not just surviving the flight, you are dominating it. You are taking control of your body, your health, and your safety in ways most travelers don't even consider. In the next part, we'll go even deeper into in-flight strategies, medical contingencies, and how to communicate your needs to crew members effectively without feeling awkward or demanding. You'll learn how to navigate mid-flight issues like a pro, ensuring that every leg of your journey is comfortable and safe. Now that your body is primed with hydration, compression, and movement, it's time to focus on in-flight strategies that make a real difference for senior travelers. Even the most prepared body can face surprises, and this is where knowledge and communication separate smooth flights from stressful ones. First, let's talk about communicating with the crew. Many travelers hesitate to ask for help, worried they'll be bothersome or judged. Let me assure you, flight attendants want to help, especially for health and safety reasons. A simple, discreet introduction can change everything. When you settle into your seat, press your call button once. When I approach, just say, "Hi, I'm in 12A. I sometimes get dizzy and I have a heart condition. I'm fine now, but I wanted you to know in case I need assistance." That small step gives us a heads up, allowing us to monitor and respond quickly. It's subtle, professional, and proactive. Next, let's cover seat selection and positioning. Where you sit can influence comfort and circulation. If possible, choose an aisle seat near the galley or lavatory. This makes walking for stretches easier, encourages movement, and gives you quick access if you need water or medical attention. Pair this with your ankle alphabet exercises and hourly walks, and you're actively preventing DVT and stiffness. Medication management is another in-flight priority. Never check your essential medications. Keep them in your carry-on, organized in original labeled bottles. If you have insulin, inhalers, or liquid prescriptions, place them in a clear bag separate from other liquids. Declare them if necessary and make eye contact with the crew. It communicates professionalism and prevents unnecessary screening delays. Always pack a buffer supply for unexpected travel changes. Finally, understand the impact of cabin air and temperature. Airplanes are climate controlled, but cold air in the cabin can cause circulation to slow. Dress in layers and keep a lightweight blanket or shawl handy. This keeps muscles warm and supports blood flow. By combining these strategies, clear communication, smart seat choice, organized medications, and temperature management, you're taking control of the high-altitude trap while in the air. You're no longer a passive passenger, you're a proactive traveler who minimizes risk, maximizes comfort, and keeps your journey safe. In the final part, we'll wrap everything together with a step-by-step pre-flight and post-flight routine that ensures your trips remain stress-free, no matter your age. You'll leave the airport energized, confident, and ready to enjoy your destination. Now let's bring it all together with the ultimate senior traveler routine, from pre-flight preparation to touching down at your destination. This is the blueprint that keeps you safe, comfortable, and stress-free, no matter how long your journey. Start before you even leave home. Review your health and medications. Visit your doctor and ask for a specific flight clearance. Make sure any prescriptions, supplemental oxygen, or medical devices are accounted for and approved. Print a one-sheet emergency plan with your itinerary, hotel, rental car, and emergency contacts. Keep it in your pocket, easy to access and battery-free. This small step alone prevents countless moments of panic at crowded airports. Next, request ground assistance if needed. A wheelchair isn't a sign of weakness. It's a human shield against chaos. It allows you to navigate long security lines, sprawling terminals, and crowded boarding gates without overtaxing your heart or brain. You save energy for the flight itself while maintaining dignity and independence. Once on board, implement your in-flight defense system. Hydrate constantly. For every coffee or glass of alcohol, drink at least 2 full glasses of water. Wear medical-grade compression socks from boarding until arrival. Every 30 minutes, do your ankle alphabet. Every hour, get up and walk the aisle or stretch at your seat. These small movements maintain circulation, prevent clot formation, and keep your body functioning optimally. Keep your medications organized and always in original bottles. For liquid medications, use a separate clear bag and declare it to the crew. Carry a small buffer supply in case of delays or missed connections. This ensures you can manage your health independently and prevents unnecessary screenings or confiscations. Finally, pay attention to mental clarity. Airports are overwhelming, and stress amplifies physical risk. Use your one-sheet plan, take deep breaths, and communicate clearly with staff. Let them know any health concerns discreetly. This builds a safety network around you and allows the crew to respond quickly if an issue arises. Flying over 70, 80, or 90 is not dangerous. It's just different. Your body reacts uniquely to low humidity, low oxygen, and prolonged immobility. By following this routine, doctor clearance, one-sheet plan, wheelchair escort, hydration, compression, movement, organized medications, and clear communication, you neutralize the high-altitude trap completely. You're not too old, you're not too frail. You are a prepared, proactive traveler who can enjoy every journey with confidence and ease. Book that trip, pack smart, and step into the airport knowing you are fully in control. Safe travel is not luck, it's preparation. And now, with this flight manual, you have it all.